Hi guys, John Rothery, osteopath. I've been asked to produce a video today to show you about hamstring strains. So as a professional footballer or up and coming professional footballer, I'm sure some of you can experience what we mean by hamstring strains today. So we've got three types. We've got grade 1, grade 2 and a grade 3. Just for a bit of anatomy, I'm just going to show you where the hamstrings are. So the hamstrings, the origin is in the back here, what we call the ischial tuberosity, and you can see this bit here. So often when a football player pulls the hamstring, they can kind of grab the back of the leg. And there's three types. There's the inside or medial part of the hamstring. So you've got semimembranosus and semitendinosus, and they insert into what we call the pes ansini here. You've also got the outside hamstrings, these here, which insert into this bit here called the bicep femoris. So with a grade 1 hamstring problem, what you tend to find is there's very little bruising. They can weight bear, and there's no indentations, and they've got full functioning of the hamstring. So hamstrings do two things. It's a two joint muscle. It can flex the knee, okay, and it can also extend. So if you lift your leg up for me. So what happens is they've got full range at a grade 1. There's no bruising and there's no indentation. Normally take a couple of weeks to recover. A grade 2, you have some bruising, sometimes the bicep femoris hamstring, which is up here and down this side here, the lateral side. They often have an indentation, but not always. There's still function, so they're able to bend their knee or extend their hip, but it might be uncomfortable or painful. And the third type, a grade 3, sometimes you can tear the hamstring where it inserts into the back here, and it can be called an avulsion tear, where the actual bone gets taken away, and that would need surgical intervention. So a grade 3 is quite painful. Also, when you examine the tissue, you might get an indentation or a slight blockage here. There'll be lots of bruising. So to test where the hamstring hurts, what we tend to do is get the patient to bend, and we pull back as hard as we can. Pull back, and that might indicate pain. Okay, it might be in the mid-belly here, and you can see the hamstrings here. This one here, yep, is the semitendinosus, and this one here is the bicep femoris, and they insert, as we said, into this bony bit here, which is the ischial tuberosity. If you want to be really accurate, we can turn the foot outwards, and we get the patient to pull back, and that'll stress the internal hamstrings, or membranosus and tendinosus, or we turn the ankle the other way and pull back hard as you can, and that'll stress the bicep femoris. So often with the hamstring tears, there's a few risk factors. Old age, sometimes patients have been playing football later into life. The hamstrings are not as integral structure-wise. Sometimes caused by slow stretching, so if you're a dancer, that can cause a hamstring tear. Ballistic movements, like if you're a footballer, stop and start, can cause the problems. Another factor can be what's called leg length. So if you've got a slightly longer leg, if you see your podiatrist at your club, they could identify that. What you tend to find is the ankle will roll outwards, the tibia would roll inwards, and the femur would roll inwards, and it puts more stress on the hamstrings. Often if you don't warm up properly. And also the quads to hamstrings, you should have a ratio of 3 to 2. So the quad should be 3 times to 2 times the strength of the hamstrings. Often if there's an imbalance, that can cause problems. Also, if you've got a tight muscle here called the iliopsoas, that can cause problems and cause hamstring tears, or tight gastrocs. So make sure that you're warmed up properly, and obviously you've got the right strengthening program for your hamstrings. So 2 weeks for a grade 1, grade 2 tear you're looking at 4 to 6 weeks, and a grade 3 could be up to 2 to 3 months, and sometimes they need surgical intervention. Sometimes patients present with hamstring tears, but we have to rule in and rule out other potential diagnoses. So sometimes you can get referral from the sciatic nerve, which goes all the way down the back of the leg and can mimic hamstrings. So we do a couple of tests to eliminate that as a diagnosis. So all we want you to do is straighten your leg and drop your chin to your chest. If they had pain all the way down the leg, not just hamstring stretch, but they had pain down the leg, then that would be indicative of potentially, relax now, that would be indicative of maybe a bulge of the disc or some sciatic nerve involvement. Another thing we do is take the reflexes. Normally reflexes should be fairly normal, but if they're slightly diminished, then that would point towards maybe a disc prolapse or a bulge, which would obviously rule out the hamstring problem. So we just tap below the kneecap, and a little bit of a flick there, and we tap here. This is L5. We tap the Achilles for S1 or S1 distribution of the back, and they're normal to me. So that would be ruling out any problems with any bulging or tearing or sciatica. So it would be safe to treat the hamstrings now. So we've decided what sort of grade the hamstring problem is, whether it's a 1, 2 or 3. If it's a 1, then obviously you'd maybe find some sort of tender area in the hamstring belly, so maybe between the semimembranosus and tendinosus. What we use is a Grafton tool. I've put some ointment on there, and I use a screening technique, so I just use the side of the blade, and all I do is just work out where the tension is, which is here. So with a grade 3, you might do some light Grafton or some light FRI just to get some blood to the area. If it's a grade 1, you can do a little bit more, and you can see here now it's starting to get a bit red, so you get new blood to the area, helping with the pain modulation. And then what you can do is you can do a couple of things to get the patient to lengthen the hamstrings. You can drop it down slowly, and you can see, as we showed on the video before, there's the semimembranosus and tendinosus tendons and this bicep femoris. So if it's more medially, you'd work on this area here. So you're going to drop it down slowly, not yet, Matthew. And you could just edge the Grafton tool around that semimembranosus and drop it down nice and slowly, and we can just work through a little bit quicker and back up. And we can do that a few times, just working through that semimembranosus tendon in the mid belly and back up again. And then one more time. And then once you've done that, you can use your sort of hand techniques. You can do, if it's a grade 1, you can go a little bit deeper than a grade 3. So from here, I just follow the line of the membranosus, so drop it down slowly, and I'm just using my body weight and just working through that tendon down to the insertion, back up again. Again, fix in. And if you wanted to use the bottom of the fingers, you can do the same thing. So you stabilize the pelvis and just work your way through that muscle. You get some strengthening work into here as well. So I could do some isometric contractions. So at different angles, rather than 100% to test for the hamstring pain, we could do isometrics, maybe 30, 40% to bring some strength back into the fibers. So just pull back for 10%, a bit less, Matthew, and just hold that there. And you'd hold that for 10 seconds, maybe 30, 40%, then drop it down, try different angles, push up again. Yep. And then we go back to just dropping it down nice and slowly. So you're again working through that hamstring. Nice and slow, just working through the fibers. Again, you can do some techniques where you're just trying to get some new blood to the area, breaking down them adhesions. So these are some of the techniques that I would use with a Grafton tool, and obviously with my hands as well. You could do some acupuncture here as well. Cool. So we've assessed the hamstring, and we're going to start some treatment. So this is in the acute stage. What you can do is use K-tape, and what it does is it lifts the tissue up, improves the blood supply to the area, and provides a structural framework for the hamstring. So remember what we said in the first video, you've got your inner hamstring, semimembranosus and tendinosus here, and on the outside you've got your bicep femoris hamstring. So what we need to do is put the hamstring on stretch. Say it's in the mid belly here between semimembranosus and tendinosus. What we do is get an eye strip. So we don't want it to be at the back of the knee, not with a footballer, because you're going to sweat during a game and that could come off, and it could also irritate the skin. So what we do is we peel the back of the eye strip, we lay it on just on the ischial tuberosity here on the medial side, and then what we do is we put no stretch on, we take the tape down, pull off the ends and just lay it down with no stretch, and then just peel the paper back. We can heat activate the glue. I mean, it depends on the athlete. Sometimes I could put 2 strips down here. It depends where the problem is. If it's on the outside, the lateral side, we maybe put a strip down here. And where the muscular tightness is, which we identified on the assessment, we're going to put 2 eye strips in across. So the first one, what we do is we peel the middle. We don't want to get our fingers on the tape to cause it to lose its stickiness. And what we do is, like a plaster, we pull it back about sort of 60% stretch over X marks the spot. So this is where the pain was. We pull it there and we lower the tape down, and then we heat activate the glue. And then on the same one, we do tear the middle. We pull the ends back, try not to get our fingers on the tape. And with about 60 to 70% stretch, we put it in an X where the problem is, lower the ends down. And we leave that on for about 5 to 6 days when it's in the acute phase, and they could shower in it, no problems. And it just provides that structural support, lifts the tissue up, new blood to the area, and allows the tissue to heal. So that's taping for a hamstring strain. So we're now looking at the strengthening phase of the rehab, coming towards the end of the rehab. So what we're going to do is just do get some movement into the hamstring itself. Remember it from the last video, the hamstrings are a knee flexor and a hip extender. So all we're going to get Matthew to do is lie back for us, and all he's going to do is roll the ball back and forth. So often with the hamstring injuries, this will improve that extension of the knee. And then to make it harder, we could actually get him to do some isometrics. So as he rolls back, just push your heel down, hold it for sort of 5 to 10 seconds, and then roll it back out again. And then try different angles of doing some isometrics. So maybe there, push back, and then back into increasing that range of movement. From there, we can do it with 2 legs on the ball. So you put 2 legs on the ball, make it progressively harder, bring the heel back to the bum, and out again. And to eccentrically load it, we could go fast up, and slowly back. So this is eccentrically, so load and under load, or slow up for 5 seconds and fast back. We can chuck in some isometrics, so if you go up again and then halfway push back, and then we can get him to bridge now as well to make it even more harder, and then back and forth for me, Matt, which is a lot more testing on the hamstrings. And after this phase, you're almost ready to start doing some jogging and turning movements with cones, then obviously joining in with sort of football progression. Cool, thank you.